Happy Tata Tuesday. We are jumping in deep today. We're going to be talking about a topic that you probably have not talked about a lot. We're going to be talking about nipple changes. You know what? This is a word that it's hard for us to say sometimes, just like looking at yourself and feeling yourself is difficult. But nipples are a very important part of our body. Women have them, men have them, boys and girls have them, and so we need to know information about them so that we can have the best breast health education about our bodies. So everybody repeat after me the word nipples. Let's just go ahead and say it, let's giggle, and let's move on, okay? The nipple is made up of a couple of parts. The nipple is actually the protrusion area right in the center of your breast. It's actually surrounded by the areola, which is the colored part. And so we're going to kind of be talking about that whole area there. People say, well, what's a normal size? Well, nipples are all different sizes. They can be big or little. They can be round. They can be pointed up. They can be pointed down. They can be pointed sideways. Or they could be any combination of all of those things. So nipples have their own personality, just like people do. So we have different sizes of nipples. Nipples also come in different colors. Just like every one of us on the face of the earth have different shades of skin, our nipples are in different colors too. So they could be red or brown or a light peach color, or they could be a dark brown, they could be a black color. And that color actually changes over your lifetime. And as you get older, it tends to get a little darker. If you're pregnant, it gets a little different. And so the colors of nipples are different. There's also, if you look at your nipples very closely, there are bumps right around them. And those bumps are actually hair follicles. So some nipples are going to have hair around them. They're going to have maybe hair that's a little even different than other parts of your body. Some people may not have so much hair around their nipples, but that's a normal type of thing. The other thing that I want you to know about nipples is that they can change depending on temperature, what's going on in your body, just that kind of stuff. So if there's a discharge, I know some people talk about a discharge coming out of your nipples. That is not necessarily a normal thing unless you're pregnant or you are nursing. That liquid is going to be milk that will nourish your baby. And there may be some sweating, there may be some other things going on. Having a discharge in your nipples is not necessarily a sign of breast cancer. It could be cyst, it could be hyperthyroidism, it could be some medications that you're taking. But if you see a fluid or blood or something coming out and you can't figure out why it's there, you're going to want to go get that checked. Some people talk about nipple pain. Some nipple pain is going to be a normal thing, especially for younger women. If you are going through PMS, if you're having your period, you can have some pain and discomfort going on then. So it's hormonally related. If you're allergic to something, maybe you've been out into the poison, and you've got itchy nipples, or maybe you've worn the wrong size bra, or you've not had a nice clean fresh bra on and some chafing has gone on there. So there are a lot of reasons that you could have some skin irritation. If you can figure out what it is, you don't have to worry so much. But if you've got skin irritation around your nipples and on your nipples and they just don't seem to be what they normally are, you want to go get that changed too. There also can be some times when your nipples are red or flaky, and again, that may be dry skin. It may be that you need to put some petroleum jelly like Vaseline on them or some lotion on them. It may be that whatever clothes you're wearing they're really rough, or you're allergic to that. So there's a lot that's normal about nipples, although if we were all to take our clothes off, and we're not going to do that, but if we were all going to take our clothes off and look at each other's nipples, we would see 2 times the nipples. I mean, they'd all be different. Mine are not exactly the same. Yours are not exactly the same. We're all going to be different, but that doesn't mean they're not normal. So there's a lot we've never talked about nipples. You've learned some things today, but you check yourself out, look at yourself, know what your normal is. And if you see changes that occur, you can't figure out what's causing those changes, you want to go get those checked, because nipple changes can be a sign of breast cancer. And that's what Going Beyond the Pink, and that's what your breasts, what's normal, what's not, is all about. Teaching you about this part of your body so that you'll be comfortable, and if something changes, you're going to go see the doctor. So, your homework this week, you got to take those clothes off, you got to get to know your nipples, and then informally, just check them all the time. Take a good look at them, see how they feel, and that's your homework. I'll check in on you next week to see if you've done it. And next week, we'll dive in even deeper to this what's normal, what's not. See you next time.